my name is Tracy Bradford, and I'm going to talk to you today about the rising cost of healthcare insurance. I also would like to discuss with you why, with everyone, someday it'll be a privilege to have one of these cards. And yes, this is your everyday, basic, third-party insurance card. And why most of us will rely on this one 100% to help with our healthcare costs. This is what I use is a flexible spending account because I myself have a very high deductible with my premium now, as of most of us Americans do, and this will only continue to change, and someday, yes, someday, it will be a privilege to actually have healthcare insurance. So please sit back and relax today, and let me try to explain to you and help inform you today on the rising cost of insurance healthcare and why someday some of us may not be able to have this privilege of carrying this insurance. Unfortunately, the economy has been ever-changing, and over the last probably 5 to 6 years, insurance has gone up, causing a big problem with employers being able to carry coverage for their employees, and employees being able to even handle the premium costs themselves, and then on top to having high deductibles where we are required to pay not only our premium payment, but also have to pay our high deductible cost as well. For a lot of us, ending up, we are paying the same as if we would be better off not even carrying insurance and just carrying some type of health savings account and just paying with that throughout the year. The only bad fall on that is if you have a major medical issue, then of course you're going to have that high hospital bill, or an emergency or anything like that, a surgeon or whatever, you're going to have that high cost. So you do run the risk of not carrying insurance and having a high bill or something that your insurance would cover. Granted, you pay your $4,000 deductible, and like most of us have also a co-insurance, so at least they would pay 80% of that huge bill. If you didn't have insurance, then unfortunately you would be responsible for that full bill. So today I'm just going to sit back, I'm going to sit here, and I'm going to try to explain to you what's going on with our insurance today, and hopefully that'll be a benefit to you, and maybe questions that you might need to ask yourself, because someday you may be plagued with, am I going to be able to carry health insurance for my family? Am I going to be able to protect them? Healthcare costs are climbing much more rapidly than incomes or growth in the overall economy. And this was quoted by a lady named Sarah Collins. 2/3 of the working age population was uninsured, underinsured, reported a medical problem, or did not need health care because of the cost in 2007. According to Sarah Collins, again, more than 2 in 5 adults ages 19 to 64 reported problems paying medical bills, had accumulated medical debt in 2007, up from 1 in 3 in 2005. So that's a huge change. Unfortunately, their difficulties included running up medical debt, not being able to get medical attention when needed, and dealing with collection agencies about unpaid bills, or having to change their lifestyles just to pay their medical debts. I don't know how many people in this economy today are having to give up anything extra, and sometimes going without some other needs just to be able to cover their health care costs. I want to discuss with you the effects that our economy has had on our health care. Due to high health insurance premiums, millions of workers have no health insurance coverage because many employers can't even afford themselves to pay their part of the premium, and then on top of that we're having to pay our part, but a lot of employers can't even cover their share. Only 63% of all employers in the United States offer health coverage insurance to at least some of their employees in 2008. That's down nearly 70% since 2000. For a large company in 2008, annual premium for an employer-sponsored family policy reached $13,000, and based on health insurance trends will increase 60% by the year 2013. With salaries only increasing 34% during 1999 to 2008, insurance premiums for employees have increased 120%. That is astounding. This is causing employees to pay about $3,400 annually on their premiums, and this is not including the out-of-pocket expenses for deductibles, co-insurance, and co-payments. So not only are you paying a high premium, high deductible, but then you have all these other expenses, including your prescriptions. Those are outrageous as well, and insurance is not covering those quite as well. Because the premiums are going up, this is causing employers to delay wage increases. According to Ben Bernanke, chairman of the Federal Reserve, rapid increases in health spending also portend increasingly difficult access to health services for people with lower incomes. As health spending continues to outpace income, health insurance and out-of-pocket payments will become increasingly unaffordable, which is what I've been trying to tell you all along, is as the time goes on, premiums and everything is going to be so high that just being able to carry a medical insurance card is going to be an absolute privilege for us. Hopefully that day doesn't come, but I'm here to inform you that it looks like it is heading that direction. A recent survey done by the Ohio Department of Public Health found that influence of the health insurance costs is exerting pressures on consumers who are uninsured. The survey showed that high rising healthcare costs and insurance premiums for those with coverage are affecting decision-making and individual and family life choices. And when and if you get married and start a family, seeking another job, and workforce entry and retirement. Because if you switch a job, you're not offered insurance right away. If you have a pre-existing illness, that can affect you getting a job. Retirement, if you retire, you're only going to have so much coverage. So a big part of this plays into what we do with our lives. Insurance, unfortunately, is something that we really need to carry, and that is going to play a big influence on where you work and what you do. Unfortunately, our children will suffer from this increase of healthcare costs in today's economy. Our children in need of healthcare are in need of good healthcare for healthy development. If our children are unhealthy because we cannot afford to take them to the doctor, this could hinder good education achievements and career prospects later in adulthood. Paying for healthcare among Americans' top personal economic problems is hanging right up there with filling our tanks. Now granted, gas prices have come down recently, but we all know not too long ago we were paying $4 a gallon for gas, and so healthcare was ranking right up there, and thank goodness gas has come down, but I don't think that's going to happen with our insurance premiums. And yes, we are to blame as well for high insurance premiums. If we work for a large company, as I do, it takes one person with an enormous medical bill to plague the rest of us for high premiums. It just takes one major thing, and then if you work for a large corporation like I do, then you take a chance of several people having these heavy illnesses, high expenditures, which then on everyday Joes like us who don't have those problems, not saying that we couldn't, an emergency could come up and something could happen, but for most of us, we're paying the price for everybody else, unfortunately. Third-party insurance companies are not out there just to help us with insurance coverage. They are out there to make a profit as well. It's a business to them. What happens are the insurance company raise their fees. They usually have contracts with hospitals and doctors. I know in our office, the insurance companies have contracts with our office. We sign a contract with them, and we get fee for service. So there's only a certain amount of money they want to pay us for certain services that we do. And therefore, if the insurance companies decrease what they're going to pay us, then unfortunately we have to increase our rates just to keep up with buying product and keeping everyday expenses going, staff, doctors, any type of overhead. We ourselves have to make that change as well. Unfortunately with this becomes very complicated when you're dealing with insurance companies and contracts. The ideal way would be to be a practice that does not allow insurance and just has the patient pay by cash. And what that would be is that would help us decrease our costs to the patient, and in the end it would probably be the best route with the way insurance companies are raising their rates and causing everybody else to pay so much more money. It just makes so much more sense. Drug companies also overcharge for their services